You guys don't need to sit over there. If you'd like to sit at the table, you're absolutely welcome to. So it's up to you. If you'd prefer to stay away, that's all right.
That's great.
Welcome, everybody. I'm calling the Thursday, May 4th, 2023 Cuyahoga County Diversion Center Board meeting to order. Brandy, can we get a roll call, please?
Sure, absolutely. Dr. Boutros?
Here.
Crystal Bryant? Here. Mr. Mason?
Here.
Ms. Carney, present. Chief Drummond?
Present.
Donna Weinberger? Donna here?
No.
Donna. Joan England?
Here.
Chris Julian?
Here.
Dr. Perrin?
Here.
We have a quorum.
Terrific, thank you very much. Are there any public comments?
There was Dr. Boutros. There's Larry Heller signed in for public comment.
Great. Larry, would you like to make a comment?
Hi, my name is Larry
And welcome.
Heller with Dora. And first, I'd like to once again thank the Diversion Center for the great work they're doing. They're doing an awesome job. And also thank them for the quick response when we discovered, a few months ago, when we discovered a barrier about people not having phones and being unable to call in. They adapted quickly and started allowing people to walk in to make the call. I still believe there's still an issue because of the screening, that even people who come in and make the call may not be admitted. And as we know, there have been a number of people who are not appropriate for that level of care. And I believe there are still gaps in coverage in our continuum of care in our community that long-term I think we need to address, but we're not going to get into all that today. We'll talk about that later. But so my understanding is that the way all this started was we as a county made a decision to create the diversion center with the primary mission to reduce population in the jail, where there were a number of problems. Reduce population in the jail by diverting people instead of entering the jail. And I believe that that remains a primary mission. We're reminded at every meeting of this group that that's our primary mission. That's why we can't go to a walk-in center, as our primary mission is diversion. My question is, are we achieving that goal? Are we making a difference in reducing jail population through the diversion center? Yeah, I understand we're increasing usage of the center, but I think it's, from my understanding from the presentations, is that self-referrals are increasing much more rapidly than law enforcement referrals. So we've been at this for a while now, and I believe we are not making the difference we intended. We don't have all the data here, at least I don't have access to the data, but I believe we're not making the difference we wanted. And I believe if we might want to make a decision, do we re-examine the mission of diversion and try to convert to a walk-in center, or do we want to refocus on diversion and figure out what we can do to improve and make an actual commitment to do something different and start really diverting people and having a significant impact on jail population. So I would hope that we can discuss that here, or this committee might consider what is going to be our mission going forward and what are we willing to do to get there. Thank you.
Thank you very much, Larry, and maybe we'll take up some of this information, the discussion and new items as we get to it. So I want to first thank Crystal Bryant for chairing the meeting on March 1st. Thank you so very much for doing it.
You're so welcome.
And I would like to review the minutes of 3/1/23. If anybody sees it fit, I'd like to get a motion to approve the minutes.
I have one item for change.
Okay.
I had to read a particular statement from Key Bank into the meeting minutes, and I need to reflect my ability to serve on the board. That is not documented, so if we can have that change, it would be helpful. I can send it to you. Tyler had it before, Brandy.
For the last meeting, just for okay. I will make sure it gets in there.
do you have it, or did you send it?
No,
to
I
us?
had to send it to Tyler and it was graded into, but it's not reflected here.
Okay. All right, terrific. With that change, can I get a motion to approve the minutes?
Motion, I'll make a motion.
Second. Any more discussions? All in favor?
Aye.
Abstentions? And any nays? Terrific. It passes. Thank you so very much. I think the next item is the metric overview and discussion from the Adams Board.
I actually have copies of this presentation up at the front. I hadn't realized that Tyler also set them up on screen, so I did print out copies, but thank you, Tyler.
I don't think he can hear you.
He's watching.
Good afternoon, everyone. I'm Claire Rosser, Chief of Strategic Initiatives with the Adams Board of Cuyahoga County. This metrics overview will be quicker than the last meeting since it's not a year end. This is simply looking at the main points from the first quarter of this year. So if you all have your printouts, we can flip to the frontline slide, page 3. So as I always say when I'm starting these updates is that just be aware that the data throughout is calculated by discharge, not by intake. So there can be slight shifts in the numbers, very small shifts typically from month to month. There can be a slight change there. You'll never see a large change there, but and each slide has its time frame, its relevant reporting period reflected on that actual slide. So on the frontline slide, this is our call center and how many calls have been received for the first 2 years of operation and the first quarter of this year. As you can see, for the first quarter of this year, from January to March, we had 565 calls. 71 of those are from police. 494 of those are from all other categories, which includes self, community, agency, friends, family. And typically what we're seeing, this is the same sort of trend, though it has dipped slightly. We see that more calls are coming in over time, but the percentages of where they're coming from tend to stay about the same. Usually it's a little closer to 30% for the police calls, but it's dipped down to 25 during this first quarter. But again, not a huge change between, and overall the number of calls are increasing and those percentages are staying the same.
So Claire, I think one important thing to note here is that, reinforcing what Larry's talking about is that the police calls hasn't changed. The community calls have increased significantly. So we're looking at heading over 2,000. If you extrapolate this for the year, we could be twice as 2022. But the police calls, again, if you extrapolate them, that they're about the same as last. It would be the same as last year. I think also very important is that 92% of the calls are referred to the diversion center. That's extraordinary.
Okay, the next slide is operations for Oriana House. And then we have for the first quarter of 2023, 277 intakes were completed. So that means that the clients arrived on site either through police transport or other means and completed the admission process, and that includes repeat clients. So our total to date is 1,105. Now we do have a greater number of contacts. Contacts are instances when a potential client arrived at the diversion center. For those 2,124 contacts that have occurred since the center opened, that admissions process was completed 1,105 times. And as we've discussed in the past, when an individual is eligible for admission and goes through the frontline process, it's still the individual's choice to stay at the diversion center. Next slide is actually a new data point that we've added in based on questions that we've had related to this from this group. So we've calculated the average daily census, how many people are there in the, on average in the building for various quarters from the first quarter of last year, the first full year of operation, to the first quarter of this year. You'll see that there's a steady increase. We are at 20.62 as an average for our daily census for this first quarter of the year. Again, that's an average, so on some days there are many more and on some days there are less, but we have an average daily census of 20 individuals.
And capacity is 50, correct?
And the next slide, average length of stay is, this is broken down by the different types of diagnosis as well as being able to show all clients here. So you'll still see that our biggest category overall does tend to be the dual diagnosis. That's the longest length of stay, rather. So someone who is diagnosed with serious mental illness and substance use disorder might have a longer stay, but these numbers have stayed roughly the same over time as well, these different categories. But you'll see if you put all clients together, it's about 5 days, 4.91 days of stay. And again, this slide is marked for this is client numbers over since inception of the facility. And the next slide onto CIT training. In the first quarter of this year, we had 59 officers trained. That was, again, these numbers exclude the city of Cleveland just because that's done in a different way. The CIT 40-hour training was the bulk of that at 43. We also had 11 dispatch, and then 5 went through the refresher course. So the next slide that you'll see is also another new data point being included in here. We have done roll call education sessions, starting with various police districts and departments across the county. And in the first, our training staff that does the CIT trainings goes out and talks to them about the diversion center at their roll calls, often at very early in the morning and very late in the evening. They, in the first quarter of 2023, have been able to reach 334 attendees across 14 police departments in that first quarter. And you can see the number of attendees by city listed here as well.
Can I ask a question? Claire, going back to the CIT training, you know, that seemed like a pretty significant, like I'm doing the math, if we had for 2021, 673, and for the first quarter, only 59. I understand we tried to add in going to these police departments, hence the next slide, and doing some different types of outreach to them, but still trying to identify, I mean, we can't be saturated. There's still a lot more police officers in the county. So any thoughts or suggestions on that one, on why it's so much lower?
So much lower as to why the January through March.
That, or just with respect to the number of people that we can fit in a class, the number of classes we have, you know, we have 2 a month. I think they can fit up to 30 or maybe more individuals, so it just seems like those numbers are pretty low. I understand it's a 40-hour class for law enforcement, which is a challenge, and I think it's great that you guys just got CUs so that, from OPATA, so that they can get some of those for the class. It's really good, but yeah, that's just a low number of individuals that are attending.
I mean, I think that the number goals are over the course of longer than just 1 quarter, but I don't have any insights on, you know, the classes that happened during this time. Let me ask Scott.
Hey.
Did you have any insights on the
Scott,
CIT?
how often do they have to, they take it once, the 40-hour class, and that's it? During their entire tenure, they don't have to get another class?
There's a refresher.
So
There's
the
a
40-hour class is once.
Yeah, and
Right.
then there's a refresher we offer for 8 hours.
So, and do we know how many officers we have in the county?
Cleveland has what, 1,500
Oh,
sheriff's
this
offices?
doesn't include Cleveland.
Yeah, this does not, these don't.
Yeah, these don't, these don't.
I think it was, what, 1,900, does that sound correct when we did this outside of the?
We provided that data previously, I just don't
About
recall right
1900.
off the top of my head.
Okay, so we've got 1,200, got almost 1,200 of the 1,900 who had the 40-hour CIT training. So I think if we can figure out who the missing 700 are and target them, that may be the best way to ensure better attention.
I think I might have be remembering that incorrectly, sir, Mr. Chairman, because that seems low now, that, the 1,900, but I can find out for the next meeting. But understood.
Hopefully before the next meeting, so I'm sure you can find it, so. Anyway, so that's what I think we need to do.
What?
Okay, thank you very much. Thank you very much. There is some old and new items for discussion, the pilot programs with common police court for jail reduction, increased use of diversion beds. So, Randy, you wanna talk about that?
Sure. I just wanted to update this group with two of the pilot programs that we've been working on for some time now. We've mentioned them at the last few meetings. The first pilot, the one with the specialty courts within Common Pleas, was started in June of last year, and I did provide the actual policy that we put together for both the specialty courts pilot as well as the probation violation pilot. So for the first one, the specialty courts pilot, that's, there's been 33 individuals since last year. That was, for example, one of the individuals from the court administration had a family emergency today that came up. But for example, an individual might be going through the court process, and what we were told at a time is maybe that individual gets in front of a judge, they come from home to meet with the judge, and the judge happens to see that maybe they aren't as stable, or there was some type of decline in their either mental health or substance abuse history. And so it might be like a Friday afternoon, and they don't want to have to keep them in the jail for something like that. And so those might be individuals that they would send over to the diversion center to receive those services for days rather than being in the jail. Obviously, they're offered up to any of the specialty courts, but that might be a situation where they use them. And as I said, it's been about 33 individuals. Even when we started that particular pilot, I don't think we ever thought that there would be huge numbers of individuals in those circumstances. But that's been pretty consistent throughout the last 6 months with that program. Now with the other program, which I also have.
So I'm sorry, what's been consistent?
The consistency with them sending individuals throughout the last 6 months, it's 33. They've been consistent. There hasn't been too many.
So you mean 5 a month?
Approximately, yes.
Yeah, so that's the consistent number.
That's correct.
It's 5 a month?
Haven't had too many issues. We did rectify an issue with transportation. You know, we don't want to rely too heavily on the sheriff's office. They already have a lot of either transport or other work that they're doing. And that's actually worked out well. We had a meeting and we've identified some alternate ways of transport to get the individual, usually from the Justice Center over to the Diversion Center, and then the sheriff's office is used for just a backup, and it's actually gone pretty smoothly there. The other program, however, the probation violation program, which I had hoped, and I still hope moving forward, that the numbers will continue to increase. I did happen to put together just today, because I was asked, and it's at the front of the room, just a sheet on every week of this year, how many people we've had that have came into the diversion center and how many of those individuals came in for probation violations or were taken to the Justice Center for a probation violation. And the number you know, we had 1 in the first quarter, or a small number in the first quarter, and then we had a 4, we had a 3, and I thought we started to get some momentum. And really what I've found is there's two issues, for lack of a better word, that we are trying to tackle. The first one is, excuse me, the first one is that at the end of last year, when we put this pilot out, when we started it and put out the policy along with the courts and the probation office, we had known that anyone going to the diversion center for this program would need to be on a GPS bracelet. That makes the judge possibly more comfortable on sending someone over there, knowing it's a voluntary place for them to go over to the center. So part of this pilot is a requirement for a GPS bracelet. And what I found is for much of beginning last year, late December through maybe February, the courts have approximately 650 GPS bracelets, and the majority or all were maxed out or used. And so I had offered, I said, is there a way we can pay for more bracelets? And unfortunately, it's not that easy, because then it takes personnel to put them on, to watch them in the sheriff's office. There's layers. So that actually was an issue for months, and it did stop temporarily, which was great. And then it started up again. So really, that's been one of the big gaps that I do have a meeting with them. We just talked for next week, but it's really been a challenge trying to, you know, for that piece of it. I would love to not have to have even GPS bracelets. Nobody wants to keep using them, but, you know, maybe that's something that in time could make people feel more comfortable. But initially, with the diversion center being new to individuals, that just hadn't been the case, or what the court administration thought would be the best route from the beginning.
I'm sorry.
And then,
Who came up with the idea that they need to be put on bracelets?
Yeah, I don't remember that either.
oh yeah, it was part of it.
But
Everyone
who-
has to have a bracelet, the GPS bracelet. It was always part from the court administration.
And they're elected to do what?
I mean, that's who we
They don't have
met
any
with
authority to
for,
demand that.
I'm sorry?
They don't have any authority to demand that. They didn't come to the judges. The individual judge wants to put a guy on the bracelet, they can do so. But to make it a mandatory policy is just putting another hurdle in the way of success unnecessarily.
You know, I think,
And I participated in those meetings. I don't recall the bracelets being mandatory.
yep, it was part of the policy from day one, and it was something that, the administrative judge and the support staff at the time said that they didn't think we would get less people likely to the diversion center, because it was a new concept, and again, people can walk out at any time, and so they wanna make sure if they're sending somebody
They
over
can-
there.
I think they can walk out on probation anywhere.
But these individuals are individuals that are arrested and taken to the Justice Center. So the policy reads, they're taken to the Justice Center, so it's a fresh arrest that's coming in. They're screened for medical, and they're identified, oh, this could be a diversion center client. Rather than those individuals staying and end up in the jail, you know, ideally with this group, which is really great for someone who needs these services, either mental health and or addiction services, that they instead the process is that they're evaluated, medical says, yes, they're okay. They actually probation calls the diversion center hotline to make sure that they're an appropriate client for the diversion center. Then after they receive an okay, the probation calls up to the judge and says, Judge, rather than keeping them here in the jail until you see them or for the coming days or weeks, how about we send them to the diversion center where they could use these services? The judge says yes. Then the individual is taken to get a GPS bracelet and transported to diversion. If they say no, obviously, then we're notified. But they wanted to make sure that they call the diversion first, so that they let the judge, they don't have to call the judge back. If the judge says yes, send them, they don't have to call them back and say, oh no, they were denied at the hotline level. So
So-
that's why the process goes in that order.
Yeah, except the policy says that court staff shall ensure if the client is on GPS. It doesn't require them from this policy that they're on GPS.
I think that's if they're already on GPS, because many of these individuals could be already,
I'm just saying, it doesn't, there's nothing here that says they need to be on GPS. That's a part of the requirement. If this is the pilot that was approved, it
It
just doesn't say that.
it is.
So think, you know, to the judge's comment and to Bill's comment, it creates another barrier to this. If you are already on probation, or if the judge is willing to have you on probation without a GPS bracelet, it's not our call to do so.
Sure. If you look at the, Mr. Chairman, at the last bullet on the program, court staff will ensure,
If the client is on GPS.
that's the wrong policy, so the probation violation is the other policy,
Oh,
sir. That's the
sorry, I'm
specialty
looking-
courts policy.
Okay.
Randy,
And that was a question I
I
had for
think your
them
bigger
today.
problem
Can we
is,
not
no one
put
has made this
on
policy
GPS?
known to any of the judges. I'm sitting here, I come to these meetings, I know we're doing something, but as a judge over there, I never got a memo from the administration that this is an option. So,
Have you been one of the 33? You haven't been any of those that have sent from the specialty courts?
yeah, I do it on my own. I know it exists. And, you know, now I guess, well, I'm sure we're following whatever procedure, but my people aren't coming over here in bracelets. So,
But again, there's two pilots, so
my
the
people are
specialty
showing up to
courts
court
is not.
voluntarily. They might be intoxicated at the time, but they're coming in voluntarily, so I can trust that they're gonna come back. Oh,
So,
I don't
but that's
need-
a different pilot, just to clarify. So the pilot that's with the specialty courts is not what we're talking about here, to clarify from before. The pilot that is with probation violations that come into the jail and were arrested and come into jail, and that was a requirement of staff at the courts.
And
We
no
can
one
talk,
has
I would
told
love to
any of the
take that off.
judges that program exists.
So, probably, like, I was there the last December, and that we were working on this at the time. I don't recall that, but it's in there,
Yeah.
I see it.
Mhm.
But, it's, maybe that's something we should address, though.
So
This came from the administrative court judge, is that?
It did, and their staff, and just today I had asked, I said, can we talk next week about this GPS? Is there anything we can do? And literally within the last hour, it was, we still have them on GPS, it's a struggle, but we need to have them on GPS, but maybe we can find some other option. So we do have an upcoming meeting to talk about it, but that's,
So would you, Captain, just, I would like you to, this is with Judge Sheehan and his staff, is that correct? So would you please just include Bill and I to have a discussion, or anybody else who wants to
Sure.
to do that? I mean, I think it's reasonable that if they are not on GPS and the judge is willing to send them to the diversion center, there's no reason for us to interject and add the GPS as an issue. If the judge says, no, they must have a GPS, that's okay, that's the judge's rule. But I don't think we should mandate.
And if I could just add, I mean, this has always been like, you know.
You know, I'm a lawyer, Bill, so.
No, that's right. No, that's fine, but all I'm saying is this has been a rolling policy, so we're developing them as we go. And I have found Judge Sheehan to be very affable to whatever we can do or need to do. So I think all we have to do is raise it and have another discussion about it, because if it's another wall, I'm sure he'll want to take it down.
Yeah,
His
he has
his heart is in the same place as ours.
Yeah. I completely agree. Like I said, that's, the meeting for next week is to talk about the policy, but mainly the GPS, but I agree, it's been really helpful to find solutions.
So if I'm-
Include us.
Sorry.
Sorry.
If I'm looking at these, so then the specialty courts, it's completely up to the drug court, mental health judges, they decide
People
GPS or
come
not.
arrested,
But
that's
the
what
other
this is for.
courts is that.
Okay, so let's talk to them.
I would be willing to go, Tom, over there every day anyhow, so.
So here you go, you got 3 more people to add to your call if you'd like.
So that's, those were, and the other issue that just arose, and this is only in the last couple of weeks, I shouldn't say issue, is a discussion, and we're setting up a meeting now with Oriana and Frontline as well as Adams to talk about clientele going from the court over to the diversion center. And so Oriana had the crisis, so the word of crisis, whether an individual is in crisis. And so they had concerns that individuals were being sent to the diversion center that weren't in an active crisis state. But we had asked, okay, are they still fitting the description? Is it someone who needs substance use, disorder, or mental health? So it's just some of, the level of care needed for the individual, so that's something we're working for, but that's only been a recent item that came up, and I don't expect that to be a long-term issue.
So there were, so the Adams Board or Oriana House were thinking that they haven't had a crisis evaluation?
And feel free if you guys wanna
Yeah.
step in, but the activeness of the crisis that the client is in, that they pushed back a little and said, we were sending individuals from the jails that weren't in active crisis, and so that was the pushback, which.
Yeah, and this goes, Michael Randall with Oriana House. This goes back to the original mission of the Diversion Center.
Yes.
The original mission was a person who is in an active SUD or mental health crisis. That was the original admissions criteria. This is an evolution with these particular new pilot projects. And so we just have to sit down with Adams and the county and figure out, because that will involve sort of a different set of skills, because the idea is if a person may be off their meds for a few days, it may not be a crisis right now, but in a day or two it will. That's a different response that we will have to develop for that particular population. And so that's the reason for.
Yeah, so you are getting more stable I'm trying to understand that. That
We-
you are getting more stable patients than those in crisis from,
Correct.
Okay.
These may be people who have not taken the best example I can give you, and Dr. Testa, please join if you want. These are people who may not have taken their medication. They're on serious medication.
Yep.
They have a history
Right.
of having crises if they don't take their
Right.
meds. But at that particular moment that the referral is coming to us, they are cognizant, they are able to discuss things. And so
so
the
they don't
question
fit
is-
the criteria exactly?
they don't fit the criteria as it was originally designed.
Okay. And the community folks who walk in, do they sometimes not fit the criteria?
Sometimes they don't.
Right.
Right.
And what's the response?
We don't turn them out to the street. We still work with those people and we do referrals. We find out whether or not they're receiving services from another provider. We will connect them with that provider. If necessary, we'll have the caseworker from that agency come to the diversion center, or we'll transport that person to that provider. So there's a specific response.
So you just want to revisit the criteria to make sure that we're all on the same page?
Yep.
That we're-
Exactly.
Okay.
We need to be
Dr.
really
Testa,
clear.
good to see you,
Yep.
by the way.
Yep, thanks.
So are we looking at expanding it then, so people that maybe are borderline, maybe not quite crisis, will actually be able to get in then?
I think that's part of the discussion.
I would
we
argue
need
that's
to
what
have.
we've
Okay.
been doing for
Yeah,
some
good.
time, and I think it's just like figuring out where that is, because I would argue we have been doing that for a lot of the clients, and to Larry's point earlier, these are individuals from the jail, like, that's the numbers that I'm hoping to see, that they either don't end up in the jail at all, or if they do, that they get services at the diversion
You
center
know,
rather than.
the entire diversion center premise is preemptive care, right? I mean, that's the entirety of it. Before somebody goes to jail, they get care. Before they have an episode, they get care. So if the clinical staff says these folks aren't on their meds, and if they continue not being on their meds, it's going to hit a crisis, then again, that's a preemptive care. So I think this is good that you're bringing it up, and I think we should figure out how to.
Yeah, I just think we need to design a system that can address that population, because the system as it was designed was not, that wasn't. the
Yeah, that
target.
was not the target population. Just give us one.
Yeah, if I could just pile on a little bit. So I am now a private attorney, and I brought a client from Harmon Municipal Court to the Diversion Center on April 1st. And I'm only gonna, what I want to lay out is that there are holes in this. So this young lady was suffering from severe mental illness and drugs. But I spoke to the judge and I spoke to the prosecutor and said, hey, we've got the diversion center out there. They didn't know anything about it. So I took, the prosecutor said, if you can get her into the center and she goes to it, I'll drop the charges, no problem. So I did, and I brought her to the center. She left on her own after 6 days, and then had another bout with drugs and really erratic behavior. And then Southwest, she ended up at Southwest Hospital, and they ended up pink slipping her into their facility. And then she got released from that facility and ended up out on the street again. And I'm telling this because there are really big holes. I never experienced it, but this was the first client I've ever had who had mental illness to this degree. But she was just bouncing in and out of an institution, and nobody had control of her. And today, she was at First Step out in Warren where she ended up, and they kept her for a while and they released her. And for the last week, she's been running again, out on drugs, severely suffering from mental illness, not taking her proper drugs. Her mother has her now, and the whole family, and this is probably going on 1,000 times a day, but I'm just bringing it to light because I saw it. And the family just don't know what to do. They can't get anybody to help take control of it. And she's back in court again next week because she's got new charges. So there's a lot of gaps here.
In February 2020, 17 people, 17 organizations presented a methodology and an approach to close the gaps to the administration. I think if this administration is interested, the plan is still there. The Adams Board is still involved, both St. Vincent's, Metro Health, the Adams Board. Joan, you were involved. There was a Frontline Alliance was involved. There were 17 different organizations involved in creating a network that would close these gaps, and it still continues. It works. It just, one of the elements was the diversion center. There were other things that needs to happen. So I think it's still available if the administration wants to take a look at it. I promise I will get to you. Is there any more on this, or Brandy, you want to talk about RFP?
I just wanted to mention that the current contract, the county contracts with the Adams Board as the lead of the contract, and then they subcontract with Frontline Services and Oriana House to run the hotline as well as operate the day-to-day of the diversion center. And again, Adams Board it's the lead, but they do all the CIT training, and they're the ones that are the outreach for police departments. So the initial contract for a number of years, when it came to an end, we were able to do one renewal. We did a renewal that was this year, and so I have the RFP completed. I'm just putting some tweaks on it and have some questions for the new administration we're going through. But the current contract ends at the end of this year. So the RFP, you'll see, it'll go out the month of May for services beginning January 1, 24. Just FYI.
I think I think it would be good if you could pass the RFP by the committee and members for any input, especially if we're going to be changing the admission criteria or other things. Just if you can do that, and I wouldn't slow down the process at all. But if they're
So I had brought this up, and I had asked some internal, because, there's individuals on the committee or at these meetings that may respond to the RFP, but what I can do is at least with the admission requirements, put together that information and send it out, but I can't send out the actual RFP.
Yeah, that's fine. Whatever portion you think would make sense for
Input.
I would do that.
Brandy, is there a possibility to maybe send the RFP out with a deadline date for input, but also add a disclaimer? If you plan to apply, then you can't provide input.
No, because they can't see it. They can't see it prior to it officially being released, because then I give it to some people and not everybody, so you're not able to do that.
I got you.
Yeah, but I can do the admissions requirement, which is the most important to generate feedback on, I think, here. Knowing that there's only so much flexibility, but to hear input.
That would be great. So, Crystal, you, Vice Chair Crystal Bryant, you want to talk about the Community Input Committee and some thoughts.
Sure, thank you, Mr. Chair. For the last, I don't know, almost year now, we've been hearing from the community input who provides public comment at every meeting. And they had some original recommendations and suggestions. One was about how do they better or further engage us as a board in terms of some of their suggestions. And also like, how do we provide support to them in terms of marketing and increasing capacity in that way. I know that one of the recommendations initially offered talked about us breaking down into subcommittees. It's not a large board, we're breaking into committees that would help us meet the mission of what we're here to do. And so just wanted to make sure that we were able to have some level of conversation if we had time for it on this particular agenda. And so I asked the chair in the beginning of the meeting if he would allow me to introduce that for us to be able to discuss before we close out if we had time. And so for the board members here, if you all can kind of recall, Larry and Rosie have gave some suggestions about us being able to further push or have other conversation outside of this meeting of how do we engage committee and make sure as listening to Mr. Mason speak today, that all courts have information, that all attorneys have information as the diversion board continues to kind of change or evolve in its mission or its targets. So if there was opportunity to discuss what that may look like, or if we wanted to kind of talk about further breakdown. And then separately, they are the community input committee. I didn't know if they were, I see it's a question mark or it's on physically actually on the agenda today. I don't know if Brandy's idea or intent was to have Larry or Rosie kind of speak up about something today.
I think in the past, if you guys know what was standing on here, they had provided documentation and convened the committee and sent us the document that they were gonna update, so we had done that throughout last year. The administrative support, we had said that they had to provide their own administrative support to convene meetings, so this time I wasn't provided a report, but they did say that they would be providing one soon that I can share with the committee. Is that accurate, Larry?
Yeah, actually, we sent you the recommendations from our last report, and we're gonna give a verbal report when we get there.
So I think the question that the vice chair put forward is that what are the interactions aside from the quarterly meeting that this group needs or should have with the community input committee? So to have them do their stuff for a quarter and then come back and report, and then again, do it again, and then report, it doesn't seem to be a very effective and collaborative process.
That was a wonderful way.
So I think that, look, I don't believe we have even the authority to break into subcommittees, but I think we can, as individual board members, decide to work with the community input committee on any issues or separate issues that they want. So if the community input committee has different areas, I think I'm certainly willing to volunteer to work with them on one of those subcommittees. I'm sure my good friend Bill, who has all the time in the world now as a private attorney, would also do that, and whoever else, and Joan would do that. So you have three people who would be interested in working with you and Rosie on.
Thank you.
Would that work?
I just want to make sure we're responsive to the public and we're exercising due diligence. So it's not a matter of does it work for me, it's a matter of does it work for community. So if you all are comfortable with that, you can also add a fourth for the record.
Okay, so I'm saying, but we would then also,
Yeah, sure.
as represent them, be working with them
Yeah.
during the quarter and be representing them here.
Absolutely.
Okay, that's awesome, terrific. So Larry, I'll leave it up to you to tell us what it is that you want to work on, and we'll do that. Rosie, you had a comment to make?
Yes, but I was gonna let Larry go first. Is that okay,
Oh,
Chair?
yeah, sure, either one.
Thank you.
Okay, so our report, okay, I understand, we had sent a big, like, 10-page document, which was our report, including our recommendations and a bunch of additional comments, explanations, rationale for the recommendations, and additional questions. And we sent that a number of times before the last meeting, and we sent it again to Tyler when I didn't realize he had left. We condensed it, and it's the handout that's up front today, the 5 recommendations from a previous report. Number 1, the Community Input Committee, asked that this board basically give us a written response every time we do any recommendations. Because some of our committee members have said, hey, we made some recommendations a few months ago, we don't know whether they were acted on. So we just request a written response to any recommendations that we made, including the recommendation, the decision, and any action taken, please. Number 2, committee recommends the board notify the public and our committee any major changes, major contract changes regarding the Diversion Center. I think several months ago, there was a contract extension that nobody was, or at least some of our committee members said they weren't informed about.
Larry, can I comment on that one?
Sure.
That's any major changes, I update like this board if it's me, if it's coming from someone else, but if it's me, that's what we have these for. And I also know you guys are on our distribution list, and that's what I use for
okay.
any outreach to
Okay.
board members,
So then that's being handled, okay. So maybe a written response would be just a one-liner saying that's on the distribution list and you're notified. Okay. Yeah, thank you. Committee recommends the board add seats on this board specifically for individuals with lived experience, including mental illness, substance use disorder, homelessness, criminal justice involvement. In other words, representing the people we're here to serve. Number 4, committee recommends that this board propose and support establishment of a crisis center. And so earlier today we have addressed the fact that there are gaps in service in our continuum of care in this community. Whether we need a crisis center, whether we need some other form, but we do hope that we will continue to address that there are still gaps in service, and we have to find a way to fill them. So thank you for your story about really pointing out that for people like that, there is nowhere to go. That's a big gap we have. And number 5 that we just kind of resolved was that we request some support for our committee. Couple other pieces of the report. I know a while back, first we tried to submit some of the surveys we did. You guys all have seen the wonderful reports that Claire did for our online surveys. It was quite a while ago already. And you know what, until recently, we all appreciated all that Claire did and all the Adams Board did for our committee in their role. But until really recently, at least I didn't realize the extent of how much they did and how valuable it was until we don't have them. So we decided that part of community outreach is finding our most vulnerable and most underrepresented and people who need the services that we can provide and who aren't reached any other means. And we went to homeless shelters and the pop-up church shelters and encampments and treatment centers. And we conducted surveys, both written surveys and verbal, for people who don't have access to online versions. And the responses we got were very different from what we had gotten online. And first we tried to just hand those in, and then we realized that a lot of people wrote identifying information on their write-in stuff. They didn't have to put their names in on some questions. They said, please contact me at phone numbers. And on almost every page there was identifying information of some sort. So it took a long time to go through all those and redact that. And we tried to print out a summary, and then we were told, you guys don't want raw data, you want like a summary. So what I did for today is I just kind of jotted down some of the most common written comments that we received, and I'll share a few with you. A lot of them talked about no phone, can't call for the screening, and we've addressed that by allowing people to walk in and make the call from there. The only drawback there is when someone brings their 3 garbage bags of belongings, walks across town, gets there, makes the call, and they're told they can't come in. They have to go to an emergency department. And I don't want to go to the emergency department because I've been there 19 times and it don't work. They just release me. So Okay, so anyway, one of the most common was no phone. Another one was even if I borrow a phone, I can't get a call back. Another one was they don't call back on the time they said. A really common one was sent to emergency department. Okay, we just talked about that. A really frequent one was there's no detox in jails. Some of the common one was don't know anyone who has been offered this option. A lot of them said there should be no denial, no waiting period, no waiting time, no screening, no one turned away, must have walk-ins. There's no input from directly impacted people. Some other common ones, people mentioned that in the jail, there's no doctors on weekends. And a lot of people access services, whether us or the jail. Some of the most common times are Friday evenings and Saturdays. One of the really big ones was police don't use it. Police don't offer it. And don't allow it even when requested. Some other ones address dispatchers. Dispatchers don't know about it. Dispatchers said there's no such thing. I've got a lot of verbal reports, people being told there's no such thing as a diversion center, even when people know to ask for it. People are told there's no such thing as a co-responder program or a crisis intervention team. Okay, so even people, who I've met with a lot of times doing outreach, a lot of people know to ask for this stuff now, and they're being told it doesn't exist. Another common one is variations of you already know the problems. If you cared, you would do something about it. You don't care. If you cared, we would not go to jail. Common ones are jail, cold turkey detox. Emergency rooms do not give me the help I need. They discharge with written referrals and I have no access. No phone, I can't call the referrals. If I can get an appointment at the referrals, I got no transportation. And even if I could get to one, I got referrals to 6 different places and there's no way I'm getting to all of them. And all the appointments are weeks out anyway. One we got several of was left jail in withdrawal, no choice what to do. People are discharged, they're still in active withdrawal. We know what they're gonna do. I'm in withdrawal, I'm gonna go use.
Larry, I have a question for you. If, you said you've gone to the pop-up shelters, you've gone to the regular shelters, and you've gone to encampments. If we were able to create a card that had the laminated card with the diversion center phone number and everything else, and the criteria for admission, would people be able to, I think, maybe hand it to the police officer and say, here's all the information, here's all of those different things. So if somebody doesn't know about it, they can actually, they see that it's an actually existing facility that they can utilize. Would that be helpful?
I love it, that's a great idea. An official card like issued by the court that says hand this to police. Because I hand everybody flyers that has some of you have seen our crisis flyer.
Yeah, no,
Nora has a
I was
crisis
saying,
flyer.
something from the diversion committee, center committee, to say that the diversion center exists.
Yeah.
Here are the criteria, and here's the phone number for the person to call.
Yeah, so we give out a flyer that says, if a
Yeah, I
life-threatening
can't make the
emergency,
court
call
to do anything.
911. For this, you call 988. For a mental health crisis, you
Yeah.
call 623-6888.
Yeah.
For diversion center, 623-6888.
I have a number of cards in my desk still from when we did the trifold and the cards, and so I'd be happy to provide more. Those
Okay, that would be good for them to have, to be able to give to
Yeah.
individuals who would need. Okay.
So at all these shelters and out on the streets, Nora is distributing a flyer with all the different phone numbers to call for different needs. We also have a little business card that says for life-threatening 911, mental health crisis 623-6888.
Scott,
But
can we,
something from the court, police might take more seriously,
I'm not sure we can get anything from the court.
or from the county.
Scott, do you think I can work with you?
I just want to say that we have all of that information that he's talking about. So Larry, what you're saying is interesting there. The Adams Board has worked very hard getting all of this information out to the community. We worked with Oriana House, we even with the CBCF, we are putting the diversion center information on and a card for the judges. I mean, so, and Larry, so, I mean, we have provided this information. All of the police officers have cards that they're carrying. So for people who may be sometimes saying they don't know about it, I don't know what personally the Adams Board could do about that. That has been addressed many times. And if people don't want to take the card, or they lose the card, or whatever, but the police officers know about it. And remember with the police, that the police are the ones making the decision whether they want to take somebody to the diversion center. We treat them right, we let them know in CIT training, we let them know in all of these other trainings, right? Right? Yeah, so all of those things are there. You can't make a person send somebody to the diversion center. And I don't know how much more information we could put out there, Larry, you know, to provide to people. So I
So
just
Scott,
wanna say
my question to you is that, do you still have those cards?
Yeah, we have them, the county prints them for us.
Yeah.
Yeah,
We do.
they're, like I said, they're in my office.
Yeah, and we'll just hand in more,
Yeah.
give you some more.
Yeah.
Yes, I'm sorry.
Right, because Brandy and I mean, communicate, Claire.
Yeah.
right?
Thank you.
Claire,
We
did you-
work with the
did you wanna add
communications
something,
department,
Claire?
In the county, on all of this.
Wait,
Claire, did you wanna-
Still got a lot more.
Yeah, Larry, we're gonna stop. Just give me 1 second. Claire, did you wanna add anything?
Oh, I just wanted to add, as far as easy to distribute information, we still have the guide for friends and families to the diversion center in both English and Spanish, as well as various cards and trifolds as well, which, you know, got 'em.
So again, all these things I just read off, those are not my opinions, these were written responses to our survey.
And
People
Larry,
in the community have reported to us. We asked for community input, this is the input we're getting
Yeah.
from some of our most vulnerable citizens.
So Larry, if you can also, once you have it, if you can just send it over to Brandy, I'd appreciate it.
Okay, I think I sent copies of, what I did, I selected some of the pages
Okay,
with the
great.
handwritten stuff, and I white out, all the,
Thanks.
identifying stuff,
Yeah,
and I
great.
had several pages of that, and I sent it.
Well,
And
thank you.
that's why we were asked to make it like a composite, and that's what this list is.
Thank you
This
very
is just frequently repeated.
Okay, why don't you send us those when you get a chance? Okay.
So if we got about 2 more minutes, can I just finish that real quick?
Sure.
So just to let, our diversion committee, planning moving forward, we had a couple questions. One was, if anybody has information as to, if we're, from some of the previous reports we've seen, we understand about 100 people a year, about 2 per week are being diverted by police. But we're wondering, how many are still going to the jail, either per week or per month? And that might give us, because we don't know whether we're being effective or not at diverting people.
Yeah, you made that clear during the
Yeah,
first thing.
so what we're thinking is, if police are not using it, we've already reached out to some of our most underserved citizens. I think our next move is to reach out to rank and file officers, because we understand we have been doing all these presentations, or presenting in roll calls. Everyone should know about it, why aren't they using it? So we wanna go out and create a new survey and go find out. And I think we've done a survey for officers, but, one possibility is that was people who knew about us, because a lot of them reported they didn't know who the diversion center is. We want to reach the ones who aren't using it and find out why and what it might take to get them to start using it. So that's going to be our next move.
Terrific.
Okay,
And we
thank
can,
you.
we can work with you, the individual board members can work with you.
Mr. Chairman.
Thank you very much.
Just a
Thanks,
question,
everybody, for putting up with such a long
The city of Cleveland certainly is our target, but that's the most activity. So how much training have we had with the CPD? Do you know those numbers?
I'm sorry.
The training to the Cleveland police officers?
CIT for
I
Cleveland.
don't know them off the top of my head, no. But we've had,
40 hours,
maybe the
you're talking
captain.
40 hours?
Yes.
Chief.
CIT, that's for us, that's the specialized.
Mm-hmm.
We ask for encourage volunteers. The 40 hours, which is specialized CIT, is, we have a limited amount of officers, not everyone, I believe, is suited for that, and that's that national model.
Right.
So every officer gets CIT training, but we only have a select few, I think about 90, I believe, that might be high, they're actually CIT specialized. Again, because of national model and support, is that we get do it, invested in it, and generally folks that have family members who are experiencing some type of mental crisis. I would love to do it myself. I kind of resonate, what Phil Mason just said really resonated with me. I have a cousin that actually, it may have been his client, because exactly what he said is my cousin. Exactly what he said. I can't tell you how many times he's been in and out of facility. As a matter of fact, in Cincinnati right now in the facility, she calls me every day, just about, every day. Before that, she was in Pittsburgh. And before that, she was in Vegas. And before that, she was in California. She's back here in Cleveland. Exactly the same. Those gaps are there. And you're right, thousands of people. So back to Larry was talking about our officers. Our officers are aware of the diversion center. You know, I don't want to be in a defensive posture. You don't want to have open ears and so forth and listen. So I'm not in a defensive posture. Please don't take. But just about all of our officers are aware of the diversion. When I come to these particular board meetings, that my officers are not using it, I again go back to my command staff and send another divisional notice out about the diversion center and so forth to make sure that our officers are aware of it and they're utilizing it. Now, there's some that they will not use it. And I'll tell you one of the reasons why that was reported was that if they take someone to the diversion center, they know particularly as they leave, they're going out the back door. And some of our officers have issues with that. They just have issues with that. So that's one of the reasons, not all, but one of the reasons that some of the officers are not using the diversion center. There are probably other reasons and so forth, but I know that our officers are engaging, are taking folks to the diversion center. Also, our arrest numbers are down significantly throughout the last several years. You have to take that into consideration as well. So we're not arresting as many people. Secondly, the county's not taking as many people depending on the offense as well. So our officers are diverting themselves. They're trying not to take individuals to jail as well. So I know we're the biggest users, as we should be, versus folks that are taking their loved ones there. So we're doing what we can to make sure that our officers are active and diverting folks. Because I too don't believe everybody. I don't believe that, especially when you have folks that are diagnosed mental illness, coupled with chemical dependency, whatever it may be, or alcohol dependency. So I agree with that 100%. So we're doing what we can as a police division to divert as many people as we can.
I mean, one of the ways to look at this is to look at what the number of people we've missed. Another way to look at it is that we've helped 2,000 individuals. So that's a more positive approach, that over 2 years, we've helped 2,000 people who potentially all of them could have ended it in jail or some other crisis. So I think there's a positive change. Rosie, I'm sorry, did you want to add something?
Claire wanted to add something to the chief.
Okay, I'll wait. I'm sorry. So I just wanted to add some clarifying information about the surveys. So the Community Input Committee did a set of surveys that was wide-ranging. And then the Adams Board did a law enforcement survey that we shared all of those. And our intention was that on an annual basis, we would be able to repeat that law enforcement survey so that we have our baseline year and then we can look in future years. So I just wanted to make that clarification that we got that law enforcement survey that then can be repeated in the summer. That would be the timeframe.
Yeah.
Thank you very
When I saw
much.
that survey, I was worried we wouldn't have enough beds. I thought we were gonna fill up.
I'm sorry, Rosie?
Thank you, Dr. Winters. So one of the things, my name is Rosie Palfy, and I am a member of the Community Input Committee, and my role was to be the liaison between the Community Input Committee and the City of Cleveland Mental Health Response Advisory Committee, which was created under the consent decree, and until December, the Adams Board ran that committee for 7.5 years. So one of the things I wanted to point out is I've been a member for 7.5 years of the training subcommittee, and we did just get numbers recently, and there are currently about 126 Cleveland police officers who've been through the 40-hour training since they started the specialized training in the fall of 2020. More officers have been trained, but some have left the force or transferred into other positions. So they're not out on patrol. The other thing is that the consent decree requires officers get annual in-service crisis intervention training, which they are getting, and because I'm on the training committee, I've worked with the Adams Board staff who does that, and last year and this year, at the end of the curriculum, there's a block about the diversion center. So every Cleveland police officer has gotten training last year on the diversion center, and they're getting training this year on the diversion center. So
Great.
the Adams Board has made sure of that. The other thing was, there's been some question about staff assistance for us, and I just want to point out, I looked at the county website for this board, and it actually says leadership staffing. It says the executive shall provide staff support as needed. I realize there's a transition, I realize some staff is left, I wanted to point that out.
Can I make a comment on that, Rosie?
Yeah.
That's staff support for this board. So there's the work for this board, the minutes, the agendas, the work that's done for the board here for subcommittees. And I know that you guys have asked a number of times, but for subcommittees, that's something that, you have to provide administrative support for your board that you guys convene.
Okay, the other thing I wanted to point out was the bylaws that were passed during the first board meeting, the diversion board meeting. Article 6 committees says that the CCDB chair may create subcommittee at his or her discretion. The subcommittee shall study issues of concern and present recommendations to the full CCBD. Now, I've served on 2 county boards, advisory boards, and we had staff support, and a lot of our work was done in committee. So the committees met more often than the actual board. I realize that they're all different, but I wanted to bring that up. The other thing is, I think we need to look at what is happening with St. Vincent's and our crisis continuum of care since they went from being a psych ER to more like a psychiatric urgent care, and then in addition to Metro Health opening their new hospital. How has that affected all of this? Because I'm sure there is some sort of impact.
Yeah, I think, Rosie, would be probably way too early to
Yes,
look at
yes.
either St. Vincent's impact or the Cleveland Heights impact. I'm sure the Adams Board is going to get information, I think, and I would say, I would give it a year's time in order for you to see how things are settled. I can tell you is that I've spoken to different agencies around here, and people have seen an increased number of referrals that they used to get from the St. Vincent's Catholic Medical Center. It's now are coming, from other folks. So there's constant change right now, and there's going to be a new equilibrium, and I think it's just going to take a little while for us to see where it goes.
Right, thank you. I just wanted the board to be mindful, and Mr. Oseki can correct me if I'm wrong, but I believe that the Adams Board has already contracted with a consultant to look at the county's crisis continuum of care.
Yes, that's
So that is, I guess, already in the works. The other thing I wanted to mention, something Mr. Mason brought up, I'm a Parma resident. I went to a city council meeting last summer to bring up the diversion center. And I had a conversation with our wonderful police chief, and it seems like there is some confusion about the difference in the level of care between taking somebody to a hospital and a diversion center. So, I mean, if you got a police department that's around the corner from a hospital, they don't realize that somebody may go to the hospital, not need that level of care, and be discharged. And not get the kind of services that they would get at the diversion center. So I wanted to bring that up. And then finally, I was, part of the Diversion Input Committee as the liaison for the Mental Health Response Advisory Committee, and I am no longer a member of that committee since the city took it over. And so I'm going to be stepping down from my role in the community.
Well,
I'm still going to come to meetings, but.
You're welcome to come to meetings with us.
Thank you.
I appreciate it. And Ms. Lou, do you have a comment?
Yeah, don't miss me, I'm right here. Fortunately, even Rosie right now, is not formally, MRAC, member to be the liaison, but I am the new MRAC members, one of the new members. So if you think you will have the need, I will volunteer to be the liaison. Also, I understand from the very beginning, 7.5 years ago, Adamsboro was the one first jumping into the field, put in all the efforts. However, the gaps today from the discussion, we know different gaps still exist. It may not be the same gaps as before, but they do exist. One particular issue I addressed in last meeting, unfortunately, our chair was not here at the time. Some of the rules, it may seem reasonable for people doing administrative work, but it does not go with the reality. I'm talking about the people using the services. Last meeting, I presented the actual incident because I personally helped. This person really had a crisis from the shelter. I tried to get this person into diversion board. However, this person even already moving into Cuyahoga County for over a year. But you know, most of the people, if your driver license state ID doesn't go to the 4-year expiration date on your birthday, not that many people will go to change the address, everything immediately. So her ID is a valid issue by the government, but it's not the address with Cuyahoga County. So she was refused.
I remember you speaking about this at the
Yes.
last meeting, Lou, and Mike and I had talked about it, and I can't speak to that specific incident, but we had talked about it. and he said-
However, because the rule said in a certain way, and it seems like today, nowadays, lots of the workers are afraid of think slightly outside the box. I'm not talking about bend the rules. This person stay in the shelter. Actually, they probably could request a shelter letter. A shelter letter will actually prove this person has been inside of Cuyahoga County.
Yeah, that's what
In
we
the shelter.
discussed, that
For-
someone, if they can prove that, I
Yes.
mean, Mike, we
But
talked
the
about this, you're not
problem here
denying
is,
people for this,
This is
correct?
the reason why from our survey, from the community input is really true. And I'm also a member of that. Lots of people got rejected. Yes, either their documentation could be put on question mark, no immediate solution for it, or yes, some of the officers are new. They have not got a training yet. Because our turnover rate, even in the police force, is real. And lots of the incidents we know of, they may not happen in Cleveland. They can be in other suburb cities inside the county. And unfortunately, the police departments in our suburb cities, they don't have the same training, same level of the understanding, the knowledge to know diversion center actually could be the best solution they should consider. This is the reason why lots of them do get the answer saying, the police told me they don't know. They don't know if that's real. The reason I know for sure, because if these people ended up in the homeless shelter or certain places I have a direct contact with, I will get information directly from them.
Thank you very much.
So if the police right now and Adamsport are doing all the effort and they are not in defense mode, and please, we should let the community understand, we believe what they tell us as well. Don't make them think that they are not believed in the first place. Thank you very much.
Thank you, Lou. So let me just,
I get 30 seconds, please?
no, let me just finish up with a couple of things. The first thing is, I just want to, again, thank the input from the community. I think it's very important for us to hear. I'm going to ask you to make sure you sign in and have for public comment. I don't want to go out of order as I did this time, so please sign up for public comment.
This is throughout our discussion. Sorry about that.
So please do that. I sincerely appreciate it.
I understand the point. However, if my question or my comment is based on our discussion, which will not happen at the beginning of the meeting, then I will not be able to make a comment.
I understand, and I've recognized you as such, but if there's a public comment, I would appreciate that you sign in to do that. Is there any new business?
I have one, Mr. Chairman.
Yes.
I just
Oh,
want.
no, I want to do it, so I'm sorry. So everybody was talking about support, so I would want to welcome Jacoya Gordon, who is joined our team in support. Jacoya, would you like to say a few words?
Sure, thank you. Again, my name is Jacoya Gordon. I am a program specialist with Witness Victim Service Center, which falls under the Department of Public Safety and Justice Services. My primary responsibility is to oversee county's child serving programs, particularly related to trauma and violence. My involvement today, and as we advance throughout the life cycle of this committee, is to learn more about what is happening on the ground and how I can best support the work that you all are doing. In addition, I would take meeting minutes and make touch points with individuals who I need to follow up with. Thank you.
Thank you very much for doing this. We sincerely appreciate it. Was that
She's
your?
really great, yeah.
Yeah.
She's really great.
Was
We thank
that your
Tyler
last-
for his work, but
Yeah.
thank you. And that's all I have.
Yeah.
How about your phone number?
I'll send the contact information out. You can give it to him now, but I'll send it out to everybody. I just wanted her to introduce.
Is there any new business? And, all right, terrific. Meeting is adjourned. Thank you, everybody.
Thank you.
Thank you.
I didn't mean to stop you there.